Hey Nadia,
Hello.
how are you today?
I'm good. How are you?
I'm good. I had a really nice weekend because the snow was super good in Tahoe. It was
Mm-hmm.
really a special treat. And then unfortunately, we had to leave Tahoe early, but that meant that because there was a storm coming in, but then that meant I had a whole lazy day on Sunday to organize an unorganized corner of the house.
Which
Can you guess which
corner?
corner I picked?
There's a lot of unorganized corners in the house.
I did the hallway desk,
Mm.
junk drawer area.
I was gonna say the closet, the shoe closet.
Oh, yeah. We kind of did the shoe closet a little bit a couple weeks ago. And then I
Mm.
did my own closet and purged clothing that I don't wear. I did that last week. So I
Do
guess
I
I'm in
get
a
any?
spring cleaning kind of mood, even though it's not yet spring.
It is spring.
No, not spring. Well, spring semester.
It's almost spring. The groundhog said it's spring.
Oh, okay.
So
When was Groundhog Day?
the second. You
Oh,
don't know when groundhog.
am I supposed to just know that? Is that common knowledge?
Mm-hmm.
Okay. The question that I have for you today is something that stems from um, kind of like what we talked about last week, which is like surprises or things that you've learned as you've come into college about like how to take care of yourself.
Mm-hmm.
Um, Last week, we talked a little bit about surprises or things that you learned about living in the cold.
Right.
But I'm wondering what has been kind of like revelations to you, things that you didn't think about before you went to college about taking care of yourself, maybe some questions that you still have about how to take care of yourself. I think
Mm-hmm.
all this could be really good advice for high school students coming into college.
Yeah.
So I guess let's start with your medicines. Like, what questions did you have about medicines and how have you figured them out?
Well, I feel like the main thing that I've been dealing with recently, or I guess in the past, like last semester, is that usually, well, one, I feel like somehow at home we always just have medicine, or if I need medicine and it just shows up. That's not really the case when I'm like at school. But I did come to college with a bunch of medicine that I have ended up using and some that I haven't, but it's like helpful to have. Um,
Like, what
so
medicines
there's
do we have
that.
at home just on stock that you didn't
Well,
realize you'd have to buy for yourself?
here's the thing is like now it's a combination of that, but also like learning what like if my body needs medication or like what kind of medication it might need just to like make me feel better, which I don't usually do at home because I feel like the way that like we are at home, we just like we just don't take medication and we just like let it pass, which I do end up taking on that like mentality. Except for in some situations where I just like feel like I need to like get through a school day or get through work that week. So I would like I like not I'm not like I'm not self-medicating in that way, but like or if I for example, I've had like itchy eyes recently. I feel like before I just like let it pass for specifically one itchy eye. And so I've been taking Zyrtec because I know that like Zyrtec helps with like itchy eyes. Like I'm like learning my body in that way. Um
Is it helping or
the
not?
Zyrtec,
Hmm.
the Zyrtec does help. I don't know if it's like mental, but
Is it currently helping with your itchy eye? Because the
yeah,
question would be if you have an itchy eye only on one side, is it allergies or do you
that's what
have
I mean. I
an
looked it up
infection on that eye?
already. I already looked it up. I'm a very strong believer in WebMD and not in a this that's not a good thing, but I do look up my symptoms on a daily basis if I'm feeling sick.
Mm.
And they told me I could take over the counter anti allergy medication. So I did, and it was good. it was fine.
Oh,
And
good.
obviously the pretend doctor in me has already examined my eyeball, so it's not pink eye.
Yeah, that's what I was hinting at. But I have a friend who's a physician who loves speaking with people as they transition to college and like figuring out how they need to take care of themselves. And I said, what do you guys talk about? And she listed a bunch of things. And specifically she said, I like giving advice about how to follow WebMD, like how to read WebMD and like what advice to follow and what not and things like that. So
I feel
maybe
like,
we can bring her on.
Yeah, we should. I feel like I've used it. I use it too much. But regarding medication, I feel like at home we don't I don't take Advil at home. Like we don't take Advil. But when I'm here and I have a headache that makes me want to die and cry and crawl up in a hole, and then I take Advil and suddenly I'm better, then I'm like, oh my goodness, the medication works. Which I don't know, you could tell me is a good thing or a bad thing, but I see it as me learning what my body needs sometimes and not, as you would say, letting it pass.
Okay.
But I wouldn't say that, like, I would say, I don't know. It feels like a more of like learning it's just like a learning process, I feel like. I know I don't need it all the time, so I'm not going to overuse it. And I can see like when people are like, oh, like just hand me 3 Advil and I'll be better. Like I don't see it like that. I see it as like, I don't know. Obviously these things are here to help me, and I had it in my, like we bought it together. So obviously it's here for something. But I don't know.
Okay. I think you got part of what we were getting at before when you lived at home, which is like, if your body can process it on its own, why not let it? And, you don't have to take the medication. Mm-hmm. But also the other reason that, the other thing that I want you to do before you take the medication is question like why you have the headache. So, the medication that makes the headache go away deals with the symptoms, but doesn't necessarily deal with the root cause of why the headache came. So like if it's...
I'm not treating myself. I'm just managing pain.
Yeah, managing symptoms. But like then maybe you should like figure out why you have the headache. Like, is it because you didn't drink enough water or eat enough food or...
Right.
Yeah, blah, blah, blah.
I didn't get into that part, but I just meant like when I use medication. I think.
Do you know the difference about taking Tylenol versus Advil or Excedrin or like all the different headache medications?
I've never used Excedrin before. Advil, I don't know it in like a scientific way. In my head, Advil feels like more. I don't know. I'm honestly just making it up, but this is how my brain works. Is Advil is like more like short term, like smaller things, whereas Tylenol I usually take. Like I know when I was younger and now, like Tylenol is something I take when I have like a fever, when I'm like actually sick. I've actually haven't used I haven't recently to use Tylenol. I don't know. I mean, same with Advil. I haven't used it recently, but I wouldn't like go straight to like, okay, I'm going to take a Tylenol.
What about, okay. So I guess I don't need to quiz you on this. Maybe we should just like quiz the physician on this, but there's like, different reasons to take the 2 different medications and they act in different ways, but they both actually can help with fevers and they both actually can help with headaches. And this is not meant to be medical advice. And I am a physical therapist, not a pharmacist or a physician. Mm-hmm. So I hate to put some medicine advice out there from the physical therapist, but there are, different parts of the body that process the 2 different medications. So that's something to consider when, when you're taking the medication. But we can ask. Yeah, we can ask the doctor about that. I was also
thinking, I know now, and like difference. There's like ibuprofen and there's acetaminophen, and acetaminophen is Tylenol. But acetaminophen is not Advil, so that makes it different. I don't know if that's like me working at the health center or me just like reading the medication bottles.
Yeah.
But I would say the one that I don't really know how it works, but I use anyways is Zyrtec. And I don't know if that means I should probably learn how to take it or I don't know, it's actually working. But I know I
Okay. What
only
about
take one a
antibiotics?
day.
What about antibiotics?
Well, those are prescribed, so I don't have like any antibiotics with me.
Do you
But
know, like, when you should seek some medical advice because maybe you need a prescription medication? Or have you had to do that?
I haven't had to do that here, knock on wood. But I don't know. I honestly don't know. I feel like a lot of times some people don't like, for example, know they have strep throat and then just go through um without the antibiotics at first. But I guess if it gets so severe, I feel like when it's like lasting for longer than it should be, you know. Um, or I don't know.
What are
I
some
don't
other
know. That's like
reasons?
when I would go. But honestly, that's like another thing that I've had to learn with like taking care of myself is like my health insurance plan here is different because there's no like Kaiser plan here, right? And
Mm.
it's like I don't know how good Northeastern insurance is in general. It's been hard. I'm not hard. I haven't had to use it, but like I don't know what's covered. And I've been talking to you guys about it recently because I realized like by working at the health center, I like have no idea when I had my last physical. I haven't gotten my eyes checked in a really long time. And I had to order contacts and I had to contact my like an eye doctor and be like, can you have an emergency refill because I'm not going home for a long time or like for enough time to get my eyes checked.
Okay, so what
So
are all the things that you feel like you have to wait until you get home to do?
well, it feels easier for me to just wait to get home to get my eyes checked, go to the dentist, get my physical, like all of that. Because I don't know. I feel like also Northeastern insurance right now feels kind of like temporary. Doesn't feel like something I'm going to be using for a while. So why would I like establish care somewhere when I don't know how long I'm going to be using it or how long I'm going to be able to use it? Um, Yeah, but honestly, this all stems from me working at the health center because I don't think I would be thinking about it if I didn't, which is another thing. Like, I just assume you guys just always did it. So then I never, like, scheduled my appointments for myself. And so, unless you told me to, like, oh, just go schedule like, I don't know. There's a lot of things that I didn't realize I had to not that I didn't realize I had to do, I just forgot that were my responsibility now. Um, but it's still
Including making
easier.
doctor's appointments.
Yeah, it's still easier for me. Like I can totally make my doctor's appointment, but I'd rather do it at home.
Right. But you're
Because
not coming home anytime soon. So,
well, I mean, I'm gonna have to come home to get my stuff done because I don't think I want to do it here. I honestly, it's so much work. I was like trying to look up, I don't know. It's just like it feels so much easier if I do it at home.
right. But you have 2 or 3 more years at least in Boston. So maybe your life would be totally easier in the long run if you found a dentist and a primary care physician and an OB-GYN and
Yeah, probably. I just
figured out where to get
that's
contact lens
like
refills.
so overwhelming for me. Like that's another thing is like all of a sudden like you're taking care of yourself but all by yourself. So like finding all these things is like I just don't want to do it. I like feeling overwhelmed just by you saying it right now. Um
Oh man.
but I'm also like surrounded by it at work too. So I guess like that's another thing. I guess if it wasn't what I was dealing with all day, then it wouldn't be that big of a deal. Um, but yeah.
I guess that's one hard thing about moving away from your hometown or home state for
Right.
college is that you have to think about whether or not you want to establish care somewhere else.
Mm-hmm.
Um, as a physical therapist, sometimes I work with young folks because that's my specialty is the young athletes and dancers. And they'll try to reach out to me during their summer break and winter break to see me for a check-in or to
Right.
like modify their plans or things like that. Um, and that's tough because I'm usually gone during summer
Right.
break and winter break. And so sometimes I make my way back into the clinic just to see those people that are coming home from
Mm.
college and for whatever reason haven't established care where they are. But
Yeah.
yeah, it's
I don't
probably
know.
best for you find somebody that you trust. It's something you're eventually going to have to do wherever
Yeah,
you end up settling.
probably. I just, ugh, that's so overwhelming. I can't even think about it right now. But I honestly don't even know who my provider is at home. So maybe that says something. It's just easier to schedule appointments at home than it is here because it's
Right.
already figured out. But
Right.
yeah, I don't.
That's probably part of you being able to go like the Kaiser system being an HMO where
Mm-hmm.
everything's within one house, in one house pretty much is easier for you because you know where all the different specialties are. It's under Kaiser.
Right, right.
Whereas people that have different kinds of insurances, like they're calling the provider, asking them if they take their insurance, and then having to call around and find out like who takes what insurance. And,
Mm-hmm.
people that don't have the kind of insurance that you have, that's what they end up doing here or at school.
Right, right. And I get calls about it all the time. So yeah, it's just, I probably should do it, but I don't want to right now. If
It
I'm being
doesn't feel
honest.
urgent.
No, it feels urgent. It just feels too overwhelming. And
Mm,
I can't, and too much to figure out. But
right.
I obviously need to.
And then there's the like mental health. Like oftentimes people will have like a psychologist or some sort of
Right.
psychotherapist that they're working with at home and then want to continue with that person while they're in school in another state, but that provider might not be licensed in the other state. And so I think it becomes difficult to stay with that provider if they're not licensed in that other state.
Right. Yeah. So there's a lot of things to think about.
Mm-hmm.
But that's
What
what I've
else? How
been.
about the non medical stuff, like the halfway stuff, like the hair products and the skin products and the toothpaste and like all the things you have to buy to
All
take care
of
of yourself? Has
all of
any of that
those
been confusing?
things, I mean, probably in Greece, but here, no, because it's all the same. I
Okay, so
mean,
let's talk
we
about that a
talked
little bit.
about
Like, let's talk
hair.
about that for the people that aren't like brand new to school, the people that are going to be studying abroad. What are some things to think about if you're going to go to another country and have to take care of yourself?
Well, it depends on how long you're staying, honestly. Like, I was not there for that long where I needed to really, like, um, repurchase everything I brought with me. But, like, I just brought a bunch of stuff from home. Like all my toothpaste, my lotion, all that stuff. But obviously the bit more basic things like shampoo and conditioner, which I did have to rebuy, I just bought whatever. But that's on me because I wasn't gonna be there for that long, so I didn't need to find something that like worked. I just needed something that like washed and cleaned my hair
Mm-hmm.
for the time being. Um, but I don't know. I don't feel like I don't know. For me, it wasn't too difficult. I mean, obviously, you have to make sure what you're buying is correct if it's in a different language, but like stuff like the basic stuff wasn't too bad. I mean, access to it might mean that it's a little bit more expensive when you buy it there versus you bringing it home, but I don't know. It wasn't like that big of a deal. I feel like with my time in Greece, like things like finding food alternatives was more difficult than finding, like toiletries and stuff because pharmacies are still a thing and all that. So
Yeah,
that
you had
wasn't
to
too
go
bad.
get medication, prescribed medication while you were there because you got super sick, right? How was that
Yeah,
being like super duper sick?
that was, I don't know if we talked about it on here, but that was definitely not fun. That was probably, and it was like my first week there. And one, we had to go to, like, my friend and I got sick at the same time. So we had to find a doctor. We went to whichever doctor was, she was a doctor at the college we were taking classes at. She did another clinic. So we went to her. We like show up at the door and the sign, it was like like the buildings where you push the buttons to get let in, but it's all in Greek. So I'm like, I had to pull up my phone and it just wasn't, I just started pushing all the buttons because I knew it was on the fourth floor. So I was like pushing every single button. Me get in there and I'm like, I don't really know what to do. And talking to the doctor, obviously she knew how to speak English, but I did have to advocate for myself and be like, because my friend and I were having the same symptoms, and she almost didn't give me the antibiotics and just gave my friend it. But at that point, I was like, I guess like your question earlier, like at that point, I knew I needed antibiotics because nothing else was making me feel better, and it was like the symptoms were not like anything that I've ever experienced before. So I knew I needed it, and then once I got it, because we were from out of the country, there was some paperwork that needs to be filled out. But so like one, we go to the pharmacies and they don't have it, which is like happens here too, which I've learned at the health center is like super annoying. Um, then I go to another one and the man doesn't really speak English and also is just telling me I cannot get this medication because I don't have her paperwork, I don't have the right paperwork, all that kind of stuff. And I was like at that point so sick. It was terrible. We ended up figuring it out, but it was just like that's like hard if you're like traveling for or living somewhere for a temporary short amount of time. I don't know what do you do when you get sick? I don't know. You don't want to go to urgent care or the emergency room, but how can you get like prescribed medication if you don't? I don't know. That's hard, but it definitely wasn't a good experience. But in the end, it worked out, so it was fine.
You survived.
Yeah.
I really felt for you because I do remember being really sick when I was studying abroad. And I was older than you. I was 21 already. You were fresh out of high school. Like, I don't even
Yeah.
know if you were 18 yet.
No, I was.
You were 18. You were
I was
18.
18. It was like my
Yeah.
first
But
week there, and it was just like, and then after that, they didn't really know how I got it, and it was like a food poisoning type thing, and then like the like I guess like public health of wherever I was, like they like were trying to like track it, and then all of a sudden like people are telling me, okay, tell me what you ate every single meal for the last 12 days. I was like, I'm sorry, this isn't gonna help me. This isn't gonna help anyone because I can't remember. So the whole process as a whole was not, that was like me learning how to take care of myself for sure. Um, which is not really something I want to experience, but it's fine. I mean, I knew that going into living in Boston. So my friends here, like if they feel sick, like really sick like that, they'd probably go home because they can. So now I would have to just like figure it out on my own with you guys from afar. But
that's true. Like when I was
yeah,
studying abroad, I was a 6 hour flight away, and you're a 6 hour flight away
right,
right now. So
right. So
you might as well be in another country, but at least everything's in English.
yeah, and it's not like, yeah, things are in English. Things aren't changed. Yeah, that's another thing in Greece. Like the prescriptions, like the medication is different. They don't have the same medications. So like even with my dad being a pharmacist, like he can't really help me. So the medication's like different, or it's called different things, all that type of stuff. So yeah, not fun.
Were feminine products okay when you were in Greece? Like, were they
Oh,
relatively
actually,
similar?
never bought tampons there because I don't actually think I ever saw them. But I unfortunately had enough, and other people had them. Like, I honestly don't know if they had tampons. Well, obviously they have tampons, but like they weren't sold like in the same way that tampons are here, which is very interesting.
Mm-hmm. Anything else? Any other kind of revelations you made as you transitioned into being an independent college student?
Everything costs money. Like literally everything. And even like if it seems like something little, like it adds up in the end. Which is like, even with me having a job right now, I still feel like I can't spend money because like it all ends up adding up. So
maybe we should ask the physician about, like generic medications versus like generic ibuprofen type medications versus like branded like Advil.
Yeah, that is like, I just bought, this is not the same. I just bought $2 Q-tips on Amazon. When that box of Q-tips at like CVS, I could look it up, but I don't feel like it. It's definitely not $2.
You sure you got the same? Like you got like three? Maybe you got like 3 Q-tips, or maybe they're like bootleg Q-tips.
I got like literally the same amount. It's definitely bootleg Q-tips, but I got the same amount, and they work just the same.
Are they this Q-tip brand?
They're Amazon brand. That's what I'm saying. Generic versus.
Oh, have you tried them though? I feel like the generic like ear swabs. What are they called? I think they're called. Yeah, I don't think they're that great.
They hurt.
Is that the one you have? You have painful generic.
No, I have the Amazon ones.
And they feel the same.
They work the same. They don't feel the same.
Right. Like the hotel room Q-tip things are not the same.
Yeah, I don't know if that's a good thing or a bad thing. It's probably
technically you're not supposed to be putting them in your ear, so there's that too. Oh, but you're using it for your makeup, right?
Yeah.
Maybe you can use the good ones for your ears.
I already ran out. That's another thing. I need to learn how to like get things before I run out. But then I get things before they run out, and then I have too much. So that's another thing. With my contacts, lotion. So like, I don't have lotion. Well, you should have bought some when you're almost running out. And that's how I feel at work. When people refill their prescriptions.
That's true, huh? Because you never had to worry about buying it before it runs out at home. Mm-mm. It was always just done for you.
Yeah. I have my acne medication that's prescribed. And I'm like, why can't I get it like that? Well, you didn't order it, so why would you be able to get it immediately? Anyways, yeah, things like that.
All right. Well, I think maybe we can get some like sound planning and advice from somebody who likes to advise people before they go to college.
Totally.
All right. Have a good night.
Good night, guys.